GLP-1 medications. You see them everywhere, touted for their incredible ability to induce weight loss and help to control blood sugar. They also have other far reaching benefits, such as new research exploring their impact on helping to prevent cognitive decline, inflammation reductions, which again may ultimately help reduce the risk of cardiovascular disease along with other inflammatory conditions. And more recently, as well, even looking at whether they help to reduce the risk of getting metastatic cancers for those who have had cancer in the past. So there's a host of wonderful things around these medications with so much more education and research to follow. With that, though, there comes some precautionary things that we're really watching for. We have to watch what happens to muscle. There is some concern about rapid weight loss and loss of muscle mass. Also, along that line with bone density and tissue integrity. So, these are things people are watching and looking at closely. So, we have to really be careful that when we look at these medications, we always do it in a balance. So, the metaphor I like to come back to is looking at the body with fat loss as being a tent without having proper supports, like shortening up the tent pegs. Or in other cases, maybe a metaphor would be looking at having a cosmetic amount of work done around your house, like having a paint job without dealing with the foundation. So, again, if we want to improve the overall health and wellness of a person, the same way we might want to improve the integrity of a tent or a house, we have to also deal with the structural issues. So, before we begin or get too far along, I'm Amber Bocknek. I'm actually a physician, classically trained, and I work and practice in Ontario, Canada. I have a focused practice on health, wellness, and longevity. And welcome to our podcast, Longevanity, the intersection of where age and wellness and living your best life all come together. But just a small note before we begin. The content that we talk about here on the podcast is not intended to diagnose, treat, prevent, or cure any disease. That is in the realm of clinical medicine and is best done with your primary care provider. What we do want to do here today is open up highly educational conversations that help empower you or inspire you or bring you to ask these questions of your own care provider. So please enjoy the ride along today. Send me your questions and your messages, but most of all, please don't act on anything you hear here without having had some personalized consultation with the care provider who knows you the best. So before we begin, let's start here with the weight loss story. So, again, here we are in the era of GLP-1s, and we've had more success now than ever before. These medications really work. I don't think anybody is debating that. I think where the controversy really comes is about trying to make sure we do this safely and that we're protecting the whole individual underneath. And so, what we really need to do is plan for it. So, what are some of the things we need to look for? Well, I think the one that gets the most publicity is the whole discussion around muscle mass. Sarcopenia, or the technical name for muscle loss, really can account for 20 to 30% of the lost weight. And that's not the kind of weight loss we're going for. Muscle mass is very important for so many things. Well, first of all, we use frailty or the loss of muscle, sarcopenia, as a real indicator in older people or people who are becoming quite ill to really show what kind of health trajectory they're on. Loss of muscle mass can be associated with frailty, increased risks of falling, difficulty with balance, and again, a lot of other metabolic things go with that. Metabolically, muscle is a very metabolically active part of your body. And the energy that it burns and consumes and helps to balance is very important and critical to overall weight management. So, muscle mass is something we want to keep for balance, for posture, for quality of life, as well as for future metabolic function. So, we really need to be sure that we're trying to do our best to preserve muscle mass. Bone density can also enter into this equation. Bone density risk loss accelerates, especially with the loss of resistance training and overall activity. So we need to stimulate our muscles through weight-bearing exercise and resistance training in order to keep them strong. And having strong muscles and strong bones, well, that's an important part of all of this. How about skin elasticity? Collagen, elastin takes time to remodel, a great deal of time. And when you have rapid weight loss, you can sometimes see the fat volume leaving the facial area much faster. And without the tension in the skin can sag and people can look a lot older. Hormones can also be affected. Tight caloric restriction can affect the production of thyroid hormones, cortisol, and sex hormones. So, all of these things can play a role. It's quite interesting, actually, again, how the calorie restriction can interact with these sorts of things. And so, we do need a certain amount of healthy calories in order to maintain function. One of the key things that's really being driven home as a message in and around GLP-1s is the importance of a healthy diet. Let me give you an example. Let's take the person first who has an exceptionally poor diet, fast food all the time, really heavily laden in carbohydrates and highly processed food. When they take a GLP-1, their appetite for most people is suppressed. So if they don't take effort to improve what they're putting into their body, they're still putting in low quality caloric intake. It's just a lot less of it. And so with that, we tend to see more muscle wasting, more of these problems we've mentioned. And this is where it's really key. In order to try to maintain your hormone function, your muscle mass, you've got to make sure you're getting the right amount of proteins in, that you're getting the vitamins and the minerals that you need. So doing this under guidance and support is really helpful. I'll give you a composite scenario. Again, we never like to talk about real patients directly. Everything, again, is confidential, but let me put together a composite for you. So, a composite would be sort of a common story merged together of the typical patient or typical questions that come up in the office. So, a composite case could be, let's say, a woman who's lost maybe 40 pounds or so over 9 months on a GLP-1. She may look wonderful and fit her clothes really well, but we have to also take a look at her for how much muscle mass she may have lost of that 40 pounds. 10 to 12 pounds could just be pure muscle, and she may have lost a bit of bone density. If she wasn't supplementing with other vitamins and minerals, she could also find herself in somewhat of a nutrient derived state. So, again, this is really important that we take a look at it. The second thing that makes this very interesting is just the whole healthcare system and how it's not supported as a system to try to do some of this preventative work. Standard primary care visits focus greatly on the actual amount of weight loss and the monitoring of the prescriptions. They really don't have a lot of time or resources devoted to testing to assess bone density at this age and stage, or lean muscle mass, or to follow up with some of these more advanced measures to check overall vitamin and mineral status. The insurance driven medicine, and by insurance driven medicine, I would say in Canada, that's the provincially covered. In the US, it's for those who don't have private health care. There really isn't the finances or the resources available or dedicated to try to follow through and do the good quality preventative work. If people want to have scans done, such as a DEXA scan or a bone density scan or a full hormone panel, those things are not easily come by. And again, they don't have clinical practice guidelines that are readily available to support it for these purposes. It does not mean that it's not necessary. These are difficulties in the system that makes it difficult to access these sorts of things, and why sometimes when patients go asking for it, even specifically, they may encounter obstacles and roadblocks. So again, patients may find themselves praised for the amount of weight loss they've had, but the other areas of loss, the muscle, the bone, the hormonal function, the vitamin and trace minerals, those things may well go unnoticed. So the definition of success sometimes can cause long-term vulnerability, which is something we want to try to avoid. So what does a restoration plan actually look like? Or if you're somebody who's contemplating doing some of these things, what are some of the things to ask for or to try to seek out? Well, One of the first starting points may just be some body composition tracking. There are some non invasive tools to take a look at how much muscle you have, how much bone you have. The gold standard of all of them, although it's the hardest to come by, is something called a DEXA scan. So, this is something again that can take a look at bone, at muscle. In our office, we have something that's a little more portable, a little more accessible. We have a Seika machine, which again will take a look at the amount of muscle mass folks have, and it'll give us an ability to track it and follow it over time. But doing something, whether it's a DEXA or a Seika or an InBody, there's some other ones out there as well, beyond the scale is an important thing to contemplate and try to obtain prior to going into your full plan, and then something to monitor as you progress along. Another really important consideration, again, very much focused on muscle, is resistance training. When I was earlier in my practice, when I was, in my early 20s and 30s, it was all about aerobic exercise. Again, everywhere you went, every class offered some sort of cardio or aerobic. And it's not that cardio and aerobics aren't important, but what we're starting to learn really is the value of resistance training. And again, resistance training can just be something you do 2 or maybe 3 times a week, where you're actually trying to improve the amount of muscle bulk that you have, both for now, for fitness now, but also in the future. And you need to nourish these muscles. In the dietary parts of all of this, when you're contemplating taking a GLP-1, you really want to make sure you're getting adequate protein. Now, before I give you the recommendations for protein, I really again want to make this very clear that this is for educational purposes. There are some very specific health situations where these numbers I'm about to mention in protein are not relevant to everyone, particularly if you have kidney disease or some other isolated and important problems. You may not be able to take these levels of protein. So again, please consider this as health education and advice only. And what you really want to do is go to your own care provider to get customized care and customized recommendations before undertaking anything. So do this only under the direction of your own care provider. So with that said, average healthy individuals who don't have severe underlying kidney disease or other reasons to try to avoid protein, the daily recommendation is between about 1.6 to 2.2 grams per kilogram of body weight daily in protein. So that can be, again, for some people, anywhere from 90 to maybe 150, 160 grams of protein split up over all the meals. Another factor in all of this is hormone optimization, particularly for perimenopausal and menopausal women. There is now some new emerging evidence that shows that there's real synergy between optimizing hormone status as well as using the GLP-1s. It has been well known and well understood that with perimenopause and menopause, there are shifts in metabolism, and often this is first seen as that truncal weight gain. Truncal weight gain is very inflammatory. And so women who struggle with that also note that, again, sometimes they have a lot of unexplained aches and pains in different joints without injury that doesn't seem to settle very easily. So there's this metabolic inflammatory effect that we know happens during the perimenopause and menopause transition. And in women who have been given some GLP-1 along with hormone replacement, we do tend to find better overall metabolic and inflammatory markers. Bone supporting interventions are also important because, again, we want to keep the bone strong during all of this. So we've spoken already to resistance training, but definitely also weight-bearing exercise. And again, you want to make sure you're checking with your care provider because not everybody can take these supplements. Vitamin D, vitamin K2, and magnesium can sometimes be very important, along with other trace minerals for bone. But again, do check with your healthcare provider before initiating anything. Skin and collagen support also need to be helped. We use this through regenerative aesthetics, sunscreens to help prevent ongoing loss of elastin and collagen just from UV, and then trying to enhance the skin with other things to stimulate new collagen, such as topical vitamin C, and also then some cosmetic procedures if the loss is significant. Again, this is where, when I'm talking to my patients in the office, sometimes we talk about the analogy of the tent. If you have a tent initially with proper length poles, the tent material, the canvas, it's beautifully stretched out. It's not sagging, it holds its shape well. But if you shorten those poles, and you don't even have to shorten them by very much, but if you shorten them and no longer supporting the surface or the canvas, then again, they're just everything's not as structurally sound. The canvas will sag. And we see this in the face as well too. As we lose the supports of the face, the skin sags because gravity pulls down, everything moves in that downward direction. So there really is a connection between weight loss and changes in skin and facial aging. You know, there was she's passed now, but there was an actress, Zsa Zsa Gabor. I think she said it the best. She said, "You can have a beautiful body or a beautiful face, but you can't have both." And again, this well predates the era of GLP-1s, but it really speaks to the fact that, again, a fuller figure, although you may not be as comfortable with the way your clothing is fitting, usually has a fuller face associated with it, which tends to look younger. But as you lose volume on your body and you become more comfortable with your clothing, then ultimately we see changes on the face as well. And depending on how fast that happens, it really can impact on how dramatic the changes are. So there are things that can be done about that. But again, we want to take all of this into consideration when we're making these decisions together. So this is a conversation that happens in our office quite frequently for patients who are considering GLP-1 medications. And it really should be something that's on the table in every practice. So this is some of the main take-home points today around GLP-1s. So if you're someone who's on a GLP-1 medication or you're someone who's considering a GLP medication, please understand that a restoration plan needs to be included as part of your overall treatment plan. The restoration plan helps to determine whether the weight loss becomes a long-term health or vulnerability. So again, we want to make sure we optimize everything. This week is a newsletter week, so we're going to have a conversation around the GLP-1s in it. If you wish to book a consultation or a conversation, please feel free to reach out. And if you'd like this type of conversation in your inbox every week, please subscribe to our Longevity podcast. We'd love to see you here. Thanks again for being part of our educational session today. We're always looking for interesting and fun topics. So if there's something that you have questions on, please do feel free to reach out to me and I'd be happy to cover it. Until next time, hope you all keep well, and I'll look forward to seeing you next week.